Hello, hi, good morning everyone. Welcome back to channel Medical with Sanju. Today question on Rh-Incompability. Question number 579. Rh immunoprophylaxis in Rh negative mother is given if abortion occurs in option A more than 12 weeks of pregnancy, option B less than 12 weeks of pregnancy, option C ectopic pregnancy, and option D all of above. The right answer is option D, all of above. Administer Rh immunoglobulins to the mother within 72 hours of delivery if the mother is Rh negative and if the Rh status of the fetus is unknown or positive. There are two types administered. First, administer 3000 mg anti-D gamma globin in full-term delivery or abortion more than 12 weeks of pregnancy, which will protect the mother from 30 ml whole fetal blood. And second one is administer 50 mg Rh immunoglobulin if abortion occurred in first trimester before 12 weeks. Question number 580. Which of the following does the Rh immunoglobulin RHOGAM is appropriate for a pregnant client at 28 weeks gestation? Option A 0.6 mcg in a sanitized client. Option B 50 mcg in an unsanitized client. Option C 30 mcg in a sanitized client. And option D 300 mcg in an unsanitized client. Option D is right answer. Question number 581. A Rh negative mother who is at 12 weeks of her first pregnancy expel the total product of conception. Which of the following is appropriate? Option A. Administered anti-D gamma globin within 72 hours. Option B. Ensure anti-D gamma globin is administered at the first follow-up visit. Option C. Withdraw the anti-D gamma globin because the gestation lasted only 12 weeks. Option B. Withhold the anti-D gamma globins because it is not administered after birth of a fetus. Option A. Administer anti-D gamma globin within 72 hours. Question number 582. Rh negative mother should receive globin. Option A. Anti-D gamma globin. Option B. Acetylcholinesterase. Option C. Lecithin sphingomyelin. Option D. Rhom globin. Anti-D gamma globin. Option A is right answer. Question number 583. Which of the following postpartum women should the nurse anticipate will need Rhd immunoglobulin before discharge? Option A. Rh negative primigravida with a Rh negative infant. Option B. An Rh positive primigravida with an Rh negative infant. Option C. An Rh negative primigravida who delivers an Rh positive infant. Option D. An Rh negative primigravida who has a negative indirect COM test. Option C is right answer. Mother Rh negative and baby Rh positive. Question number 584. Anti-D should be given following Rh positive delivery within. Option A 6 hours, option B 24 hours, option C 72 hours, and option D 7 hours. Anti-D within 72 hours માં દીनुपर्छ. Option C is right answer. Question number 585. Rh anti-D immunoglobulin is administered to mother following childbirth by which route? Option A subcutaneous, option B intradermal, Option C, IV, and option D, IM. Intramuscular dinsa. Option D is right answer. Question number 586. In order to prevent active immunization of Rh negative mother, anti-D gamma globin is administered. Option A, within 72 hours following delivery. Option B, after 72 hours of delivery. Option C, within 24 hours of admission. And option D, during antenatal period. Within 72 hours following delivery. Option A is right answer. Question number 587. Prophylaxis of a Rh incompatibility is done by option A, exchange transfusion in mother. Option B, administers of anti-D to child. Option C, exchange transfusion in child. And option D, administration of anti-D to mother. Option D, administers of anti-D to mother. Question number 588. During delivery, baby Rh positive red cell pass into maternal circulation due to break in the option A, chorionic villi, option B, amniotic villi, option C, chorionic surface, and option D, amniotic surface. Due to break in the chorionic villi, option A is right answer. Question number 589. Test done to detect hemolytic anemia in newborn is option A, direct COM test, option B, platelets count, option C, indirect COM test, and option D, blood culture. Right answer is option A, direct COM test. कहिलेकाहीँ direct COM test र indirect COM test मा कन्फ्युज हुन सक्छ. There are two type of COM. एउटा चाहिँ डाइरेक्ट हुन्छ र एउटा इनडाइरेक्ट हुन्छ न. डाइरेक्ट दुईटै बेबीको लागि गर्छ, बेबी सेफ्टीको लागि गर्छ हैन. डाइरेक्ट कम टेस्ट भनेको आफ्टर डेलिभरी युज गर्छ र इनडाइरेक्ट कम टेस्ट भनेको ड्युरिङ प्रेग्नेन्सी गर्छ हैन. डाइरेक्ट कम टेस्ट इज युज टु डिटेक्ट if antibodies have bound to RBS surface used after delivery, and indirect COM test is used to detect IgG antibody in Rh negative women during pregnancy. दुईटै Rh negative मदरमै गर्छ तर एउटा प्रेग्नेन्सीमा र एउटा आफ्टर डेलिभरी. Question number 590. After determining diet of pregnant client is Rh negative, gynecologist orders an indirect COM test. What is the purpose of performing this test in pregnant client? हैन, indirect COM test दिएको छ भने यहाँ के दिएको छ क्वेशनमा प्रेग्नेन्ट क्लाइन्टमा दिएको छैन, आफ्टर डेलिभरी दिएको छैन. सो इनडाइरेक्ट COM टेस्ट जहिले पनि प्रेग्नेन्सीमा गर्छ. अप्सन ए मा दिएको छ टु डिटरमाइन द फिटल ब्लड Rh फ्याक्टर. अप्सन बी टु डिटरमाइन द मेटर्नल ब्लड Rh फ्याक्टर. Option C, to detect maternal antibody against fetal Rh negative factor, and option D, to detect maternal antibodies against fetal Rh positive factor. To detect maternal antibodies against fetal Rh positive. And option D is right answer. Question number 591. Rh negative mother delivered a baby. Which among the following list is more likely to be ordered for the baby? Option A, blood culture. Option B, direct COM. Option C, indirect COM. And option D, platelet count. के भनेको छ यहाँ मदर डेलिभरी अफ बेबी हैन, आफ्टर डेलिभरी दैट मीन्स कुन टेस्ट गर्नुपर्छ, डाइरेक्ट टेस्ट गर्नुपर्छ. ऑप्शन बी इज राइट आंसर. Question number 592. COM test is performed to predict which complication in a fetus. Option A, physiological hyperbilirubinemia. Option B, metabolic disorder. Option C, acute hemolytic disease. And option D, genetic thalassemia. Acute hemolytic disease. Option C is right answer. Next question in other video. Thank you so much.